15 years ago, I was in your shoes and applying for cardiology fellowship programs, and I was fortunate enough to match here at UC Davis, and I've been here ever since.
Hi, my name is Pankaj Malhotra. I'm one of the third-year cardiology fellows here at UC Davis. I've had an awesome experience here for the last 3 years, and I'm really happy with my choice overall to come here. What originally drew me to this program was my interest in cardiovascular imaging.
Hi guys, my name is Shamali. I'm one of the first-year cardiology fellows here.
Hi everyone, this is Maya Eng.
And this is Lily Chen.
She is a third-year cardiology fellow at UC Davis.
And she is the first female interventional cardiology fellow in the history of UC Davis Health.
My name's Chris Chen. I'm one of the cardiology fellows here, second year.
Hi, my name is Bashar Gayat, and I'm one of the second-year cardiology fellows at UC Davis.
When you start fellowship here, it's busy from the beginning. You'll start in consults or CCU or electrophysiology, and then shortly after that, starting in the cath lab, we have additional electives and for individuals who want to spend additional time to learn to place pacemakers or additional imaging time with CT or MRI.
As a first year, it's really important to know that your decisions are supported, and all of the attendings here are more than happy to walk you through anything that you may be thinking, to gently guide you in the right direction, but still give you that autonomy to grow as a clinician. The higher levels, the second years, third years, are also there as a great resource for you to act on, and everyone's really just willing to help out everybody else. And they make sure that you feel quite supported while still having the autonomy to make mistakes and learn from them in a way that's safe for patient care. My favorite part about our program is the autonomy that we have in terms of our patient care. We are supported in performing all of the steps involved in taking care of our patients, from seeing them in clinic to performing invasive procedures such as angiograms, doing the transesophageal echocardiograms, and explaining all the results and implications and options that the patients have for treatment. UC Davis itself is a great program for cardiology. We are a pretty large referral center, so you get to see a fair number of complicated cases. And there is a lot of push for fellows to be independent and to be involved in a lot of these complex cases, whether it's just your typical cardiomyopathy up to, valve replacements, all these complex procedures that you really get to be a part of.
So overall, I've really enjoyed it again, my time here, and I think one of the best things that I can say about it is it's really helped prepare me for what I'm going to get at the next level in my advanced cardiovascular imaging fellowship, and to do so in such a family-oriented manner with such great relationships with all of my co-fellows and the attendings has really been wonderful.
We've had fellows pursue academic careers in large academic centers across the country, or we've had fellows that are more interested in pursuing clinical practice, and they have joined multi-specialty, very robust training programs or very robust clinical programs throughout the country as well. And the feedback that we consistently get from all of our graduates is that compared to others, their training program really set them up for success. Our fellows will read more EKGs, will perform more transesophageal echoes, and be primary operator on more angiograms than any other institution. And this really is the foundation to what sets them up for success.
So as someone who's from Dubai and moved from Ohio, Sacramento is the perfect weather. It's definitely not cold like Cleveland, but it's not nowhere near as hot as Dubai. So the weather's always nice and the sun's always out. And it's very close proximity to Lake Tahoe, and I love water sports, so I enjoy paddleboarding in Lake Tahoe.
So the program at UC Davis is like family. I remember as a first-year fellow, within a couple months of the start of fellowship, Our program director at the time, Dr. Smith, all invited us to his house for a large party. And it wasn't just the fellows, all the family members of the faculty, as well as the family members of our other fellows were all present. And that really made me feel included within this new UC Davis family.
They are so invested in you as a human being and developing you into the best human doctor, cardiologist, interventional cardiologist, whatever you want to be. They are invested in getting you there and getting you to be the best one that you can be. And I think it's that personal investment and the strength of the faculty in terms of their own clinical skills and acumen and research and everything like that that really solidified my desire to stay here.
Yeah, I absolutely agree and echo what Lily said. I don't think there's anywhere else where you will find so many faculty members who are not only giants in their field, whether that's structural heart disease, advanced heart failure, even, basic general cardiology practice, and yet they're still so invested and dedicated to teaching their fellows and like you said, just really helping you be the best physician and person you can be, which I think is incredibly unique.
UC Davis is about family. The cardiology division here has always been about family. And when you come here for training, more importantly after you leave, that family relationship doesn't stop. Even to this day, we still constantly communicate with our graduates. They've always come back to us for feedback. And this is something that is difficult to explore in a video or difficult to see on a website. But that is really the heart of what UC Davis cardiology is about.